You wake up before you've even poured your coffee, you check your numbers, and there it is again, that high reading. You sit there looking at that little screen, and that familiar knot of frustration and anxiety tightens in your chest. You are doing everything they told you to do. You are sacrificing the foods you love. You are spending money you shouldn't have to spend on treatments and supplements that promise the world but just aren't working. And when you finally sit in that cold examination room and ask your doctor why nothing is changing, why you still feel this way, they look at their clipboard, shrug, and tell you, well, this is just normal aging. No clear answers, just a prescription refill, a pat on the back, and they send you home to figure the rest out completely alone. Take a deep breath right now. Let that tension go for a minute. I am Dr. Michael Kent, and I want you to hear this very clearly. You are not failing, your body is not broken, and what you are experiencing is a specific cellular roadblock. It is not just normal aging. I know you are tired of wandering through conflicting advice. I know you just want a straight answer that actually works from someone who is actually listening to you. Today that stops. Today you are not managing this alone. We are going to look at 3 humble, accessible leaves: bay, guava, and mulberry. We aren't going to talk about miracle cures or expensive, hyped-up products. We are going to look at the quiet, clinical science of how these specific plants help unlock your cells. Our goal is to protect your heart from damage and bring those numbers down naturally. Before we look at the exact mechanisms of these 3 leaves, I need to be clear as a doctor, this consultation is for your education. It does not replace the relationship you have with your primary care physician, and you must monitor your numbers if you are currently on medication. We are going to take this step by step, and we are starting right now with your morning numbers and how a simple bay leaf can help fix the lock on your cells. Let's talk about that morning number. You went to bed doing everything right. You didn't eat a late night dessert. You followed the rules. Yet you wake up and your blood sugar is elevated. Why does this happen? Because while you were sleeping, your liver released glucose to give you the energy to wake up and start your day. But the cells in your muscles, the exact places that are supposed to absorb that glucose, refuse to open their doors. In clinical terms, we call this insulin resistance. But I want you to think of it simply as a rusted lock. You have the key, but the lock on the cell wall is jammed no matter how much insulin your pancreas pumps out. The door stays shut and that sugar stays trapped in your bloodstream, just waiting for you to test it in the morning. This is where the bay leaf, specifically Lauris nabilis, enters your treatment plan. Most people think of bay leaves as just a flavor for soups and stews, but in clinical biochemistry, we look at the powerful compounds extracted from this leaf when it is properly steeped. First, we look at a specific essential oil inside the leaf called eugenol. Eugenol acts as a biological lubricant for those rusted locks on your cells. Clinical observations show that when these specific plant compounds interact with your cell membranes, they increase your insulin receptor sensitivity. They help clean out the rust. So the insulin you are already making, it can finally turn the key. But there is a second mechanism here, and it addresses a massive failure in standard senior healthcare: magnesium deficiency. The bay leaf is incredibly dense in magnesium. Magnesium is the physical mineral required for your muscle cells to pull glucose out of your blood. The problem is standard doctor's office blood tests rarely catch this deficiency because they check the serum, not the inside of the cell. If you are deficient in magnesium, and the vast majority of my frustrated patients are, your cells simply do not have the physical strength to open that door, no matter how strict your diet is. So how do we use this to fix your morning numbers? We don't just cook with it, we use a precise clinical extraction. Take 2 dried bay leaves, place them in a cup, and pour about 250 milliliters of hot water over them. Now listen to me very carefully here, because this is where almost everyone makes a mistake in their kitchen. Do not use boiling water. If you pour boiling water over these leaves, you will instantly destroy the eugenol and the delicate volatile oils that actually do the cellular work. You want the water hot, around 80 degrees C, or just before it starts to bubble. Let those 2 leaves steep for exactly 10 minutes. I want you to drink this warm infusion in the evening, a few hours after your last meal. By drinking this at night, you are delivering a concentrated dose of magnesium and insulin sensitizing eugenol into your system while you sleep. You are setting a healthy metabolic floor. You are lubricating those locks so that when your liver releases that morning glucose, your cells are actually prepared to absorb it. Let's pause for a second because I know exactly what many of you are thinking right now. You are sitting there saying, Dr. Kent, I have already spent hundreds, maybe thousands of dollars on exotic supplements, vitamin blends, and metabolism boosters. I bought the bottles with the fancy labels because they promised to fix everything, and a month later, absolutely nothing changed. Why should I believe a simple leaf is going to do what a $100 pill couldn't? Your skepticism is 100% justified. You have every right to be angry. You feel like you are failing, but you aren't. The reason those expensive supplements didn't work for you is because the supplement industry pre-spiced Band-Aids that completely ignore the actual physical damage that high blood sugar is causing inside your body every single day. Fixing your morning number is critical, but let's be honest about what really keeps you up at night. It isn't just a number on a monitor. It is the fear of what that sugar is doing to your heart. It is the fear of cardiovascular disease, stroke, and losing your independence. When your blood sugar stays elevated, especially after you eat a meal, that sugar doesn't just float around harmlessly. It undergoes a process called glycation. Think of glycation like caramelizing onions in a pan. That excess sugar binds to the proteins in your blood vessels and literally caramelizes them. It turns your flexible, healthy arteries into stiff, rigid pipes. This is why your blood pressure slowly creeps up year after year. This is where the plaque builds up. And no overpriced, overhyped metabolism pill from the health food store is going to stop your arteries from caramelizing. To actually defend your heart and stop that arterial stiffness, we have to look at a completely different biological mechanism. And we do not need to empty your wallet to do it. We need to look at leaf number 2, the guava leaf. To stop that caramelization, that glycation process stiffening your blood vessels, we use leaf number 2, the guava leaf. Most people are familiar with the guava fruit, but in clinical biochemistry, the leaf is where the true metabolic power resides. When you have chronically high blood sugar, your blood vessels are under constant oxidative stress. Think of it like leaving a piece of untreated metal out in the harsh rain. Eventually, it rusts. Right now, because of that excess sugar, your arteries are essentially rusting from the inside out. The guava leaf contains an extraordinary concentration of a specific polyphenol called quercetin. Quercetin is a microscopic defender. It specifically targets your endothelial lining. That is the very delicate, ultra-thin inside wall of your blood vessels. When you consume a properly prepared guava leaf extract, the quercetin acts as a physical shield. It neutralizes those rusting agents, the free radicals, before they can stiffen your arteries and drive up your blood pressure. But this leaf doesn't just protect the arteries after the damage is done. It goes directly after the source of the spike. Guava leaves contain bioactive compounds that inhibit an enzyme in your digestive tract called alpha-glucosides. This is the specific enzyme responsible for breaking down the carbohydrates on your dinner plate into the sugar that floods your bloodstream. By partially blocking this enzyme, the guava leaf slows down that entire absorption process. Instead of a violent, dangerous glucose spike after you eat, your body experiences a gentle, manageable curve. Your heart doesn't have to panic because this leaf is also packed with native vitamin C. It helps those arterial walls relax and expand. When your blood vessels can relax, your heart doesn't have to work nearly as hard to push blood through your body. Here is your exact clinical protocol for the guava leaf. This is your pre-meal defense strategy. Take 4 fresh or dried guava leaves. Place them in 500 milliliters of hot water around 90 degrees C. Let them steep for 10 minutes. But we are going to make this protocol even more powerful. Before you drink it, I want you to add the juice of half a lemon and 1 teaspoon of cinnamon. The lemon adds a synergistic boost of vitamin C for your arteries, and the cinnamon adds a secondary layer of insulin sensitizing compounds. Drink this warm infusion about 15 to 20 minutes before your largest meal. You are essentially preloading your digestive tract with a biological shield. When that food finally hits your stomach, your body is already fully prepared to defend your heart and flatten that spike. But even with that guava leaf protecting your arteries, I know the daily anxiety isn't gone. Let's talk about what happens when you actually sit down to eat. You go to your regular doctor's appointments, they draw your blood, they check your A1C and your morning fasting numbers. Maybe they tell you it's a little high, but they shrug and say it's manageable for your age. So they send you on your way. But then you go home, you make a sensible dinner, you have a small piece of potato or maybe a scoop of rice, and an hour later it hits you. The crash, you feel completely exhausted. Your vision gets a little blurry, your heart might even race, you test your blood sugar, and the number staring back at you is terrifyingly high. When you tell your doctor about this, what do they say? Just watch your carbs. No clear answers, no real strategy. Here is the medical truth the system is failing to explain to you. Fasting numbers are only half the story. The real danger, the actual immediate damage to your body, happens in the 2 hours after you eat, and standard medicine almost entirely ignores those post-meal spikes until you are already in a full-blown medical crisis. Because of this gap in the system, you are left sitting at your kitchen table, staring at your plate, literally afraid to eat a normal meal, because you don't want to trigger that massive sugar surge. You are forced to figure out the complex science of carbohydrate metabolism completely on your own. You shouldn't have to be afraid of your food, and you shouldn't have to manage that post-meal panic by yourself. To fix this, we need to bring out the heavy hitter. We need to physically intercept those carbohydrates in your gut before they ever have a chance to hit your bloodstream. And to do that, we are moving to leaf number 3, the mulberry leaf. When we talk about stopping a blood sugar spike after a meal, we are usually told to just eat less bread or avoid fruit. But for many of you, your metabolism has become so sensitive that even a small healthy serving of complex carbohydrates sends your numbers into the red zone. This is where leaf number 3, the mulberry leaf, or Morus alba, changes the game entirely. In the world of clinical pharmacology, there are very expensive medications designed to block the enzymes that digest sugar. But nature has already perfected this mechanism in the mulberry leaf. Inside this leaf is a very rare and potent molecule called 1-deoxynigromine, or D&J for short. I want you to imagine the enzymes in your small intestine as a specialized cleanup crew. Their only job is to grab every carbohydrate you eat, break it down into simple sugar, and shove it into your bloodstream as fast as possible. The D&J molecule in mulberry leaf is a biological decoy to your digestive enzymes. DJ looks exactly like a sugar molecule. It's a master of disguise. When you have mulberry leaf extract in your system before a meal, those enzymes get confused. They grab onto the D&J decoy instead of the actual sugar from your food. Because the enzyme is busy holding on to the decoy, it is blindfolded. It cannot see the bread, the rice, or the potato you just ate. As a result, a significant portion of those carbohydrates pass right through your small intestine without ever being absorbed into your blood. They simply exit your system. Research shows that this specific D&J blockade can reduce the glucose spike of a meal by up to 40%. But the mulberry leaf doesn't stop at your gut. It travels to your liver. Many of you struggle with what we call a stressed liver. When your liver is under pressure, it begins to overproduce glucose even when you haven't eaten. Mulberry leaves contain 2 powerful antioxidants called rutin and chlorogenic acid. These compounds act as a dimmer switch for your liver. They send a chemical signal to stop the production of sugar and start processing fats more efficiently. Now, the protocol for mulberry leaf is the most strict of the 3 because timing is everything. If you drink it too late, the enzymes have already finished their job. You need to source high-quality organic white mulberry leaves. You can find them as a loose leaf tea or a high tincture extract. Take 5 g of the dried leaf and steep it in 300 milliliters of hot water for 7 minutes. You must drink this infusion exactly 10 to 15 minutes before your first bite of food. You are essentially sending a scout team into your digestive tract to blindfold those enzymes before the meal arrives. When you do this correctly, you aren't just managing a spike, you are physically preventing it from ever happening. For the first time in a long time, you can sit down at the dinner table and feel in control rather than being a victim of your own digestion. Now, I need your absolute undivided attention for the next few minutes. Because I am a doctor and I care about your safety, we have to talk about something that most health videos completely ignore: the danger of success. If you begin using these 3 leaves, the bay, the guava, and the mulberry, exactly as I've prescribed, your body is going to start responding. Your insulin receptors will become more sensitive. Your enzymes will start blocking glucose. Your numbers will begin to move. For many of you, this is the goal. But if you are currently taking prescription medications like metformin, glimepiride, or especially injected insulin, this creates a very real clinical risk. Think of it this way: your medication is already working to push your blood sugar down. If you add these powerful biological interceptors on top of your medication without adjusting your plan, your blood sugar could drop too far too fast. This is a condition called hypoglycemia. I have seen patients get so excited about their new natural protocol that they forget they are still on a high dose of pharmaceuticals. If your sugar drops below 70 mmDL, you may experience dizziness, confusion, or even loss of consciousness. This is not a risk we take. This is why I told you at the beginning you are not managing this alone, but you must not manage it behind your doctor's back either. When you start this protocol, I want you to increase your testing frequency. If you usually test once a day, test 3 times. Watch how your body responds to the mulberry leaf before dinner. If you see your numbers consistently hitting lower ranges than you've seen in years, that is your signal to call your primary care physician. Do not, under any circumstances, stop taking your prescribed medication on your own. Instead, you take your logbook of numbers to your doctor and you say, "My numbers are consistently lower and more stable. I would like to discuss a supervised reduction in my dosage." That is how a responsible patient and a responsible doctor work together. I also want to address those of you with kidney concerns or those who are pregnant or nursing. While these leaves are natural, they are pharmacologically active. If you have chronic kidney disease or CKD, your body processes minerals like magnesium differently. You must clear this protocol with your specialist first. My goal for you is not just lower numbers. My goal is safe stability. I want you to feel the relief of seeing those numbers drop, but I want you to do it with the confidence of knowing you are protected. We have the biology, we have the protocol. Now let's make sure you don't get ripped off at the grocery store. One of the biggest reasons people tell me natural remedies don't work is because they are using dead plants. If you go to the back of your pantry and pull out a jar of bay leaves that has been sitting there since 2019, those leaves are medically useless. The volatile oils, the eugenol we talked about, they've evaporated. When you go to the store, I want you to look for 3 things: color, aroma, and origin. For your bay leaves, look for a vibrant olive green color. If they are brown or gray, leave them on the shelf. When you open the bag, the scent should be sharp and herbal. If you can't smell it, your cells won't feel it. For your guava and mulberry, sourcing organic is not a luxury. It's a clinical necessity because we are steeping these leaves to extract their medicine. Any pesticides on those leaves will end up directly in your tea. Look for the white mulberry label, specifically Morus alba. Now, I want to leave you with something more powerful than a recipe. I want to give you your voice back. The next time you sit in that doctor's office, I don't want you to feel like a student being scolded. I don't want you to feel like you have to hide the fact that you are using plant medicine. When your doctor looks at your improved numbers and asks what you've changed, don't just say, "I'm drinking some tea." I want you to use the clinical vocabulary we practiced today. Look them in the eye and say, "I have been focusing on improving my cellular insulin sensitivity. I am using Laurus nobilis, and I'm utilizing D&J rich Morus alba to manage my post-meal glucose spikes." Watch their face. When you speak the language of biology, the conversation shifts. You are no longer a difficult patient. You are an informed advocate for your own health. You have been through enough frustration. You've been dismissed. You've been tired. And you've been told that your health is out of your hands. It isn't. If you feel that you actually have a clear path forward, type the word "clear" in the comments and share this with one person who is still struggling. I'm Dr. Michael Kent. Take a deep breath. You've got this, and I'll see you in our next consultation.